Hello guys, how are you? This is Amir Ghawas. I'm in university, fourth semester. Today the topic of our presentation is drugs affecting on reproductive system. There are some drugs which can definitely affect the reproductive system. So, as we know that we have two kind of reproductive system, male reproductive system and female reproductive system. They have some similarities, but on the basis of their gender they have some differences also. So there are some drugs which can affect our reproductive system. Now we are going to discuss them step by step. Male reproductive system. First of all, we'll discuss briefly about the male reproductive system. The male reproductive system, it is basically consists of testes, which helps in the production of testosterone and sperms. Um The testes are surrounded by the scrotum, and after it, there was deferens. After vas deferens, they are going through some glands, prostate glands, seminal vesicles, and after it get into penis, the penis is ended by urethra. And about female reproductive system, the female reproductive system is consists of ovary, uh, fallopian tube, uterus. After uterus, there is cervix and vagina. Vagina is also called birth canal, and ovary helps in the production of ovum. So this was a little bit about the reproductive system of male and female reproductive systems. After gonadotropin releasing hormones, which we can say GnRH, uh, they include luteinizing hormone and follicle stimulating hormone, LH and FSH. So they are the two hypothalamic uh, decapeptide stimulates of synthesis of both luteinizing hormone and follicle stimulating hormone within the interior pituitary gland and their secretions into the blood. These two hormones, gonadotropin, their luteinizing hormone and follicle stimulating hormone, which can say LH and FSH, they are produced by the interior pituitary gland, and then their secretion gets into blood. So these two hormones are very useful in the reproductive system of both male and female. So this is the general mechanism of secretion of these two hormones. This is the anterior pituitary gland, this one. And as you know that pituitary gland, it has two main lobes, anterior pituitary and posterior pituitary. So anterior pituitary helps in the secretion of sex hormones, sex types of hormones, and the posterior pituitary helps in the secretion of oxytocin and vasopressin. As we know that these two hormones, they are not secreted by the posterior pituitary, but they are generally and they store there for temporary time. Okay, so the LH and FSH, which we can say gonadotropin releasing hormone, they are uh, secreted by the anterior pituitary gland. As we know that this is the pituitary gland, and it helps in the secretion of these hormones. Anterior pituitary helps in the secretion of LH, FSH, PRL, TSH, ACTH, and GH. There are different type of hormones which can act on different parts of the bodies and perform their actions. So all these hormones are secreted by the anterior pituitary. Now we have to discuss about LH and FSH. They play a very important role in the reproduction process. So the male reproductive system, it is a male who has reached puberty will produce millions of sperm cells every day. Each sperm is extremely small. The size of sperm is extremely very small, only up about 0.05 millimeter long. Sperm develop in the testicles. They are produced in the testicles within a system of tiny tubes called the seminiferous tubule. When we study the testes very deeply, so they are tube-like structure which we can say seminiferous tubules. So the production of sperm takes place in the seminiferous tubule. Okay, a man produce sperm every day. This general process, every man when who reached puberty, they can produce sperms every day. But a full sperm regeneration cycle, which we can say spermatogenesis, takes about 64 days. The spermatogenesis process, it takes about 64 days to complete its cycle. Okay, so this is the general mechanism. This is the male reproductive system. This is sperm, which we can say sperm. It is produced in the seminiferous tubules. These are seminiferous tubules, small. Um, they're just inside testicles, okay? And they're sperm producing tubes, which we can say the sperms are produced there, so that's why which we can say sperm producing tubes. And these are general lobules which are divided, which are being divided, okay? uh, After there is epididymis, epididymis, and after we can say that they're passing through the anterior sides of the urinary bladder, and they get into some glands, which we can say they are seminal vesicles, okay? Seminal vesicle, after seminal vesicle they pass through prostate gland, and after they pass through bulbourethral gland. So when they pass through bulbourethral gland, they get into urethra, which we can say penis, and this is the glans penis. So all these were they're passing through different glands, and which helps these sperms get nutritions. They have different mediums, so it contains a medium, a nutritional medium, in which they get grow through. So that's why they can pass and get their nutrition and their medium. So that's why there are glands present which helps in the nutritional process. And the bulbourethral gland mainly secrete a mucus type of secretion, which is oily in structure, so they can smoothly pass through. Okay. Next slide, which we will proceed. It's a little about female reproductive system and egg, which we can say worm. Or egg is also called worm. Okay, it's normal fertilized by the sperm cells in the fallopian tube. Within 9 days, the fertilization egg moves down the fallopian tube into the uterus. At the uterus, um, implants to the wall of the uterus. It can get implantation in the uterus in the endometrial wall, and after the fertilization, egg implants. Uh, the growing placenta starts releasing HCG into blood. HCG is human chorionic gonadotrophin hormone. um, it uh, it is secreted by the placenta after fertilization. So some HCG also get passed in the urine. HCG can be found in the blood before the first missed menstrual period. This can be easily at 6 days after the egg implants. So this is definitely now we know that the HCG, human chorionic gonadotropin, is secreted after 6 days. So HCG is generally also used for pregnancy test, that is there any pregnancy or not, fertilization took place or not. So HCG, human chorionic gonadotropin, which by the help of which when we take urine test, so through urine test we can find the pregnancy, that is fertilization takes place or not. So this was the general idea, and these are briefly that what takes place, weekly division. And there are some, for example, we can say there it's ovary which helps in the production of ovum. When the ovulation takes place, ovulation of secondary oocytes, so at day zero, fertilization takes place when it get into the fallopian tube. Okay, so when it gets into the fallopian tube, the fertilization takes place, and the sperm meet with the ovum in the ampulla, which is the region of fallopian tube. Okay, when the fertilization takes place, then the unicellular division takes place, which we can say zygote. The zygote is then furthermore, this is the fallopian tube. So the zygote, now zygote, it is a unicellular structure in which the 23 chromosomes of the ovum mate with the 23 chromosomes of the sperm. Okay, after it, sorry, after at day one, they get moved through the fallopian tube in the female reproductive system. They pass through different stages, and the division takes place. So, which we can say cleavage. The mitotic division takes place, by the help of which two cells are converted into four, and four are converted into eight. By this process, eight cells that get converted into 16 cells. So They're passing through different stages. By day one, they can get converted into dicellular structure, which you can say two cell, and day two they convert into four cellular structure. So when it get reached into 16 cells division, so we can say this structure morula. Okay. After morula, the fertilized egg, it gets into the uterus for implantation. It gets into the uterus in the stage of morula. After morula, it converted into blastocyst, which you can say, and the fertilized egg which get implantation in the uterus of the female endometrial layer of the uterus, it will be in the form of blastocyst. Okay. Blastocysts, in this structure they get converted into two layer, inner cell mass and outer cell mass. The whole cells, they are differentiated into two layers, inner cell mass and outer cell mass. After it can get divided into many different types of layers, they will discuss later. So this is all about. And then the implanted structure in the endometrial layer, this is called embryo. Okay. This is called embryo. This is the whole division is on the basis of weeks. So on the basis of trimesters and week, that which development takes place in different weeks. So this is all about after fertilization, how the embryo get formed and how implantation takes place. This is the male and female reproductive system is there for continuation of human reproductions, and human reproductions is any form of sexual reproduction resulting in human fertilization. It typically involves sexual intercourse between a man and a woman. This is the whole mitosis process, by the help of which fetus, which we can say twin structure, they are converted into end-pent twin structure, and after the adolescent, the twin structure, there's the whole cycle, So in this structure, the sperm and egg, there will be the 23 chromosomes of sperm which will pass from male, and the 23 chromosome they will get passed from a female in the palm of ovum. They're haploid cells. So when they combine, they will again form twin structure, and again the mitotic process they will take place and the division will take place. So this is the whole criteria about mitotic division. The next we have the main motto which we have to discuss is drugs affecting on male reproductive system. Those drugs which can affect the male reproduction and their process, they include androgen, the first one. Their classification is on basis, they are on different bases. So the first one is androgen, which we can say they are under generic name danazol and testosterone, and their branded name is danocrine, and testosterone is under branded name androderm, and depotestosterone, striant, androgel, and fortesta. And the second one is anabolic steroids, which we can say oxandrolone, under their generic name oxandrolone and oxymethylone, and under branded name they are oxodrine and enderol pefti. The third one is phenyl erectile dysfunctional drugs, which are used for the erectile function dysfunction. They are under generic name alpha-stodril and sildenafil, tadalafil, and vardenafil. They are under generic name, and under branded name they include Caverdict and Miss Viagra, uh, Revitio and Cialis, Esteresa and Levitra. There are different drugs which are used for phenyl erectile dysfunction. So uh, the second is the first we have discussed is androgen, under generic name denazole, which we can say denocarine is a synthetic steroid derived from testosterone. This medication is used in a woman to treat pelvic pain and infertility due to certain uterus disorders, which we can say endometriosis, which is used for the purpose of endometriosis, and also used in both male and women to treat breast pain, tenderness, nodules due to certain breast condition, which we can say fibrocystic breast disease, and their internal dose is used as 50 milligram, 100 milligram, and 200 milligram, which has no paternal dose, and their half life is about 3 to 10 hours. There are some side effects of these drugs which we can say that it includes the side effects include a sign and decrease in breast size, weight gain, oily skin or hair, flushing, sweating, vaginal dryness, burning, itching or bleeding, and nervousness. So these are the side effects of these drugs. Uh, Furthermore, androgen, which we have discussed, testosterone, primary hypogonadism, congenital or acquired testicular failure due to conditions such as cryptokidism, bilateral um, tourism, orchitis, vanishing testis syndrome, or orchiectomy, Klinefelter syndrome, chemotherapy, or toxic damage from alcohol or heavy metals. These men usually have slow serum testosterone concentration and gonadotropic efficiency and LH above normal range. And the internal doses capsule, which are include 158, 198, and 237 milligram, which has no paternal dose with a half-life of 8 days. And the side effects of these drugs include assigned degrees in breast size, weight gain, oil skin or hairs, flushing, sweating, vaginal dryness, burning, itching or bleeding, and nervousness. Furthermore, which anabolic steroids we have anabolic steroids under another name of oxandrolone, oxandrine, which we can say oxandrine or oxandronol is indicated as adjunctive therapy to promote weight gain after weight loss following extensive surgery and chronic infections to severe trauma in some patients who, without definite pathophysiological reason, failed to gain or maintain normal weight to affect the protein catabolism associated with prolonged administrations of corticosteroids and for the relief of the bone pain frequently accompanying osteoporosis. The internal dose of these drugs include 2.5 to 10 milligram, which has no paternal dose and having half-life of 9.4 to 10.4 hours. And the side effects include geriatric patients treated with uh, androgenic um, androgenic anabolic steroids may be in the increased risk for the development of prostatic hypertrophy and prostatic carcinoma. Okay, next one we have penile erectile dysfunctional drugs, which include sildenafils, or which we can say Viagra. When sexual stimulation causes local release of NO, inhibition of phosphodiesterase type 5, which is indicated by PDE type 5 by sildenafil cause increased level of cyclic GMP in the corpus cavernosum of the penis, resulting in smooth muscle relaxation and inflow of blood in the corpus cavernosum of the penis and the mass of erectile tissue that lies along the underside inside of the penis and are located below the pair of corpus cavernosa, which contain 90% of the blood volume during a normal erection. Generally, we use these drugs, Viagra, we can say they help in the relaxation of smooth muscle which are present inside the penis of the corpus cavernosa of the penis. So when they get relaxed, the inflow of blood increases through this side, and so the erection takes place. So these drugs has the internal dose of 50 milligram, having no paternal dose and half-life of 3 to 4 hours. Viagra may be taken anywhere from 30 minutes to 4 hours before sexual activity. Generally, their dose can be taken before 30 minutes or 4 hours, and the maximum recommended dosing frequency is once per day. The side effects include flushing, warm redness or tightly feeling, and headache, dizziness, informal vision, blurred vision, changes in color or visions, and sleep problems, which we can say insomnia, the loss of sleep. This is a general disorder. So when anybody takes these drugs, they will face such kind of problem, insomnia, also runny or stuffy nose. Furthermore, drugs which affect the female reproductive system. There are also some drugs which can affect the female reproductive system and cause some dysfunctional, or which have some general effects on these systems. So the first drug include estrogen, and the second uh, it's progesterone. Estrogen is under generic name they are found as estradiol, estrogen, conjuncted estrogens, esterified estropeptide, and under branded name they are found as estress, and CS, Primarin and Minister Arthurist, again, and Carva, Sekalaza and Yasmin, YZ, which we can say Yaz. So in the progesterone, they are found under generic name of desogestrol, ironin, and estrogestrol, levogestrol. Also, they are found under generic name medroxyprogesterone and northindrone acetate, norgestrol, progesterone, generic, and ulipristal. And under branded name, they are found as Cariva and Seclaza, Yasmin, Yaz, Amplanon, and Mirena, Plan B, Provera, Augustine, and Red, and also it includes LA. Their classification is estrogen receptor. Generally, they are classified as estrogen receptor modulators. Under generic name, they are found as rolaxipin and trimethoprim, and under branded name, they are found as Evesta and Forestan. And fertility drugs includes under generic name cetrorelix and chronic gonadotropin, clomipin, and folitropin alpha, folitropin beta, and gonorelix, litropin alpha, and monotropins. And they're found under branded name as citride, Corex, Prosophy, and Frignile, Closmids, Gona F, Folestin, and Antigon, Leverus, and Pyrigonal. Uterine motility drugs are also found there, which includes oxytocin under generic name of um, ergonovine and methylgranovine, oxytocin, and under branded name they are found as ergotrate, methylgrane, and pitokin and cytosine. There are also some drugs which are found as abortifacients, which includes they are found under generic name as um, carbopost and dinoprostone. Um, Mifepristone, and they're found under branded name is Hemibet and Cardevil, Perdevil and Prepedil and Pristine E2. Contraceptive or the name given to medicines and those devices that are used to prevent unwanted pregnancy. Generally, contraceptives are used as abortive drugs which cause abortion. So, to prevent unwanted pregnancy, they help in the protection. To avoid pregnancy, they are used generally for the aim of avoiding pregnancy. So contraceptive may also be referred as birth control drugs. Hormonal contraceptive consists of one or more synthetic female sex hormones, and hormonal contraceptive that contain both an estrogen and progesterone are called combined oral contraceptive, which we can say COCs. Those that contain just progestin are called progestin only a contraceptive, which we can say POPs. So there are two kind of drugs, COCs, which include estrogen and progestin both, and which include only progestin. They're progestin only contraceptive, which we can say POP. Mm, the generic name of these drugs are drosoquinone and ethinyl estradiol. Under branded name, they are found as um, Geneva and Gismil, Riana, and Nikio, Silla, and Cydia. And under internal dose of these drugs, they can be taken as oral. Oral tablets include 3 milligram to 0.2 milligram to 3 milligram and 0.03 milligram to 3 milligram, and the half-life of 25 to 33 hours. And the mechanism of action is though the suppression of gonadotropin release from the hypothalamus. These drugs helps in the suppression of gonadotropin releasing hormones or factors from the hypothalamus. With the suppression of gonadotropin release, ovarian stimulation and follicular maturation do not occur, and the estradiol level are low due to diminished follicle productions. Common side effects are headaches and changes in the menstrual periods, vaginal bleeding between periods, spotting, missed irregular periods, nausea, especially when you first start taking Yals drugs, vomiting, bloating, and stomach cramps. There are general side effects of these drugs, and the generic name of there are different types of drugs, and the mechanism of these drugs is the prevention of the surge of luteinizing hormones, thereby preventing ovulation. But progesterone also thicken the cervical mucus and alter the endometrial lining of preventing fertilization and implantation. They can be found as and the half-life of these drugs are 36 to 13 hours. And common side effects of these drugs, they include ethinyl estradiol and evion, or also we can use Balcotra. The common side effects of these drugs are nausea, vomiting, headache, abdominal cramps, bloating, breast tenderness, swelling of the ankles, feet, retaining fluid, or wetting, and weight change may occur. We can also use IUD, which we can say intrauterine device. The first and the only hormone releasing IUD is the FDA approved to treat heavy periods, also known as heavy menstrual bleeding (HMB), for up to 5 years in the woman who choose the IUD for birth control. Okay, the Mirena intrauterine device is inserted into the uterus. There is a mechanism that how can we use IUD. So it can be inserted into the uterus by the healthcare provider using the special applicator shots. String connected to the device extend beyond the cervix and to the vagina and allow for the device removal. There are some RX which we can use. There will be generally Viagra. It is under 50 milligram, which can be used. So one tablet from 30 minutes to 4 hours. They can be used before sexual activity. Mm. Second one is dinazole after 100 milligram caps. There can be their capsules. So only one capsule can be taken per day. And furthermore, we have drospirenone and ethinyl estradiol 3 milligram or 0.03 milligram tablets, and they can be taken as one tablets per day. So um, furthermore, we have levonorgestrel and ethinyl estradiol, which can be sold as from 0.09 milligram to 0.2 milligram tablets, and they can be taken only one tablet per day. So this is all about the drugs which can affect our reproductive system in males and females. So these drugs can be mentioned because they have also some side effects, and there are some drugs which are very much useful. They helps in the pregnancy process and the production of sperm. They can trigger the production of sperm and also this was a brief idea that I had about these. Thank you so much for your attention. uh, Thank you. This was my presentation. This was all about my presentation. So thank you so much. Thanks for your attention.